Hello, Professor Meek. This is Vera Clark. I'm going to talk to you today about multiple sclerosis. It's also known in abbreviation as MS. So let's talk about what MS is. It's a chronic and progressive disease that is degenerative in nature. It affects the central nervous system, in which the insulating sheath that surrounds the neurons actually is broken down. This myelin sheath is what allows electrical impulses to travel along the nerve cells and send messages that coordinate the body's movements, perception of the environment, etc. The prevalence of this disease is actually pretty rare. It's less than 0.5% of the population. However, that percentage can be a little bit higher in individuals or populations that have a family history. This disease does affect women in a larger amount than men typically. It occurs between ages 20 and 40. Flare-ups occur and then it's followed by remission. That's not curable, but symptoms are able to be managed. The signs and symptoms that a patient would feel and that a healthcare provider would recognize are fatigue and weakness, as well as ataxia, tremors, muscle spasticity of the lower extremities, vision problems, paresthesias, decreased perception of pain, touch, and temperature, bladder and bowel disturbances, abnormal reflexes, emotional mood changes such as apathy, euphoria, depression, irritability. It also can affect memory and cause confusion. The cause of this disease is not generally well known. It's believed to be an autoimmune in nature. There is some literature that suggests that it could be a response to a viral infection. Diagnostics and labs that are used to determine if a patient does have MS is the use of ECG. Oftentimes a patient will undergo an ECG and abnormal findings will be found. Another indicator of MS is a lumbar puncture. After the lumbar puncture is completed and assessed, it can show an increase in gamma globulin, where the blood work levels show gamma globulin within normal limits. Let's talk about treatments. Again, this is a chronic disease. It's not cured, but it is managed. In 2017, one of the first groundbreaking new drugs called Ocrevus or Ocrevus, I'm not quite sure, was given FDA approval, and it has been shown to reduce relapses and slow the progression of the disease. Otherwise, treatments include chemotherapy, use of steroids, immunosuppressive drugs, anti-inflammatory drugs, therapies such as counseling, working with support groups, physical therapy, acupuncture, and occupational therapy are also used to help manage the symptoms, as well as exercise and rest. Nursing interventions for a patient with MS would include energy conservation measures when a patient is having a flare-up, educating a patient about conserving energy when possible. If the client is showing issues with mobility, the nurse would provide protection of the client from possible injury. And this can include sensory issues. So showing a patient how to not burn themselves with too hot of water, those types of things. A nurse would monitor for urinary tract infections, pressure ulcers, and also respiratory infections. They would assess for the need of assistive devices for patients who have decreased mobility and are in need of assistive devices for independent living. The nurse would assist with helping the patient develop an exercise routine as well as a rest routine, because it's very important that a patient rest during times of flare-ups to allow their body to heal. Promotion of regular elimination is also really important. Patients with MS can go between bouts of constipation and diarrhea, as well as having trouble with elimination of urine. So, promoting regular elimination and urination is important. Application of an eye patch for diplopia, where a patient has double vision, can actually help a patient cope with that symptom. It's really important that the nurse educate the patient about multiple sclerosis, the disease course, and interventions that they can do to maintain an independent living and treat their symptoms. It's really important to also teach the patient how to avoid fatigue, stress that could possibly cause a flare up, how to watch for signs of infection. Also, watch for signs of overheating and chilling as well, because a patient's ability to sense these things can become compromised when they have MS. Educating a patient about a healthy diet is really important, as well as an increase of potassium intake and increase in fluids. Safety measures such as removing rugs from the home that could potentially be a tripping risk, as well as, like we talked about earlier, teaching patients how to navigate through the world with loss of their sensory skills. Also, if a patient is placed on medication, it is important that the nurse help teach the patient about the medications they are taking and how to administrate them to themselves properly. And that is what I have today about multiple sclerosis. Thank you.